This patient was referred to me for endodontic treatment of tooth number 31. Tooth has a temporary crown on it now. His dentist tried to do the root canal and couldn't do it. So, couldn't locate the canals. As you can see here, looks like he found the distal canal. Looks like perhaps maybe he found the mesial lingual canal, couldn't find the mesiobuccal canal, and temporized the tooth and referred the patient to me. So today we went ahead and started and completed the root canal, of course, in one appointment. You can see a periapical lucency here. So I made my endo access through the temporary crown, removed the temporary filling. There were a couple of cotton pellets in the pulp chamber, removed those, and of course I used a surgical operating microscope and was able to locate all of the canals. And we were able to complete this root canal in about 45 minutes from start to finish. And take a look here. That's a good x-ray. All right. As you can see, everything went beautifully. Look at that periapical lucency there. As you can see, everything went great. And we went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. Again, took us about 45 minutes. And what I always suggest is that case selection is very important. So thinking that you can do it is very different from actually being able to do it. So if you look at the radiographs and honestly be honest with yourself and say, can I do this root canal? Imagine the root canal being done by an endodontist, and imagine how long it takes the endodontist to do it, and imagine the final product. So you need to imagine this in your mind's eye and see if you can accomplish the quickness and efficiency and high performance and level of an endodontist. Can you do that? Can you give that to the patient? Can you provide that to your patient? Is the root canal something that the tooth is something that you can do a root canal on, or based on your level of knowledge and expertise? If the answer to one, a couple, or all of those questions is no, then I think it would be best to your benefit, and of course patient's benefit, to just refer that case out. All right. So you just always want to be fair to your patients. You remember, our primary goal, our oath, is do no harm. Okay, so anyways, as I said, this took us about 45 minutes from start to finish, and I believe that if it could have probably been less if I didn't have to kind of remove the gutta perch, remove the cotton pellets, and if I had a untouched pulp floor map, because the pulpal floor map was completely destroyed in this case. So I had to look around at the microscope, use my ultrasonics to locate the mesiobuccal canal. If this patient had come to me straight away, I would have probably been able to complete the root canal in, I'd say, maybe half an hour. So the extra 15 minutes was just because there was no pulpal floor map. All was removed by the previous clinician. It just took me a little longer to be able to locate that missed canal. All right. But anyways, it is what it is. I hope you learn from my videos.